Another remedy from Phatak Materia Medica, that is Ambrosia artemisifolia. This is the 25th episode of Phatak Materia Medica live series. So let us start with Ambrosia. So Ambrosia is a hay fever remedy or viral fever remedy. We must not miss in day-to-day practice. So Dr. Phatak clearly says that it is a remedy for hay fever. Remedy for hay fever. Then remedy with profuse lacrimation. Profuse lacrimation, watering from eyes. Intolerable itching of eyelids. Intolerable itching of eyelids. Nosebleed, stuffed feeling in the nose and head. So Ambrosia is a remedy for mucous membrane, especially nose, eyes and respiratory system. This is not a deep destructive pathology remedy, it is a reactive hypersensitivity remedy. This is a reactive sensitivity remedy. So when the symptoms are violent, irritating and seasonal, you must think of Ambrosia. So the central theme of Ambrosia is irritation, congestion and hypersensitivity. Irritation, congestion and hypersensitivity. This patient not mentally disturbed, but patient is physically irritated. The body is overreacting. Small exposure, big reaction. Exposure from dust, pollen, seasonal changes leads to explosion of symptoms. So Phatak does not give any mental symptom of this remedy. So it is an important that patient may say that doctor I am fine otherwise, but this season becomes very irritable. I can't tolerate this itching. I feel restless because of my eyes and nose. So irritability due to physical suffering. Restless from itching and congestion. Physical generals very important and must be remembered. Usually patient is very sensitive to environmental changes. Symptoms aggravate by seasonal exposure. Sleep due to nasal blockage, itching of eyes and head symptoms. No profound weakness but fatigue comes from continuous itching. Peculiar symptoms is very important. Symptoms of eyes. Intolerable itching of eyelid. Profuse lacrimation. Patient keeps rubbing his eyes. Redness, watering and irritation. This itching is unbearable, not a mild type. No symptom. Stuffed feeling, alternating with blockages, nosebleed, coryza with irritation. Head symptom, feeling of fullness, congestion and heaviness. When eyes itch like mad and nose feels blocked and bleeding, think of Ambrosia. So in modern pathological condition, which condition we may see the Ambrosia is the seasonal allergic rhinitis, hay fever or viral fever, allergic conjunctivitis, pollen induced hypersensitivity. So this is the main idea of Ambrosia. Phatak gives related remedies arsenic iodide and subidilla. So we must differentiate these remedies. Differentiating remedies for hay fever and seasonal allergic rhinitis is very important in day-to-day practice because allergies patients are increasing. So let us start with Ambrosia versus arsenic iodide. Mental symptoms: arsenic iodide has anxiety and restlessness. Ambrosia has irritation due to the symptoms. Arsenic iodide has burning, asthmatic tendency. Ambrosia is only eye itching and hay fever dominant. Another remedy is Sabidilla. So, Sabidilla is mentally hypersensitive, imaginative. Ambrosia is not very characteristic mental symptoms. Sabidilla has spasmodic severe sneezing, while Ambrosia is severe itching with congestion with irritation. Sneezing drama, think of Sabidilla. Itching torture, think of Ambrosia. Another remedy, Allium cepa. Allium cepa has bland tears, burning nasal discharges, aggravation from warm room. While Ambrosia has itching eyelid, stuffed head, less discharge. So this is about Ambrosia and Allium cepa. Another very important remedy differentiation is Ambrosia versus Euphrasia. Euphrasia has acrid tears, bland nasal discharges, marked photophobia, while Ambrosia is itching more than burning, nose often blocked or bleeding. Another remedy is arsenicum album. Arsenic has anxiety, fear, burning pain, grace prostration, thirst for cold water, fastidiousness. While ambrosia is not a mental symptom characteristic, only seasonal symptoms of allergic rhinitis with irritation, with itching, with congestion. Another remedy is Calibicromicum with ambrosia. Calibicromicum has thick, ropey, stringy discharges with sinus pathology. Ambrosia has functional allergy, not thick, ropey mucous discharges. Ambrosia has irritation. Another remedy is Nux vomica. So, Nux has irritability, chilly, overwork, drug sensitive. Ambrosia is irritation is local, leading to only related to eyes. Another remedy, pulsatilla has mild VP changeable symptoms, often better in open air. Here again violent itching, irritation and congestion. Another remedy is natrum mur. Natrum mur has chronic coryza, dryness, emotional sensitivity, desire for salt. Ambrosia only has acute seasonal hypersensitivity, no deep emotional labor. Another remedy is sulfur. Sulfur has burning heat, chronic tendencies, standing, standing aggravates. This is a sulfur. While ambrosia has surface reactions, seasonal, no chronic picture. So, sneezing fits, think of Sabidilla. Burning anxiety is like arsenic. Another remedy, we must think of pothos. So, pothos has extreme asthmatic breathing, tight chest, hay fever going into the dyspnea. So, hay fever going into the dyspnea is pothos. With dominant eye itching, nasal congestion and irritation, little chest involvement, think of ambrosia. Breathlessness prominent, think of pothos. Itching prominent, think of ambrosia. Another remedy is lemna minor. Lemna minor has blocked up nose, postnasal catarrh, chronic sinus hypertrophy, severe nose block. Ambrosia has seasonal hay fever, sudden congestion without sinus disease. Chronic obstruction lead to lemna minor, seasonal allergy leads to ambrosia. Another remedy is Bromium. Bromium has laryngeal involvement, hoarseness, croppy tendency, aggravation from warm room. Ambrosia has upper nose eyelid allergy, no laryngeal dominance. Voice and larynx, think of bromium. Eyes and nose, think of ambrosia. Another remedy is Kalinitricum. Kalinitric has asthmatic attacks, constricted chest, cardiac compression, left-sided nasal obstruction. So, ambrosia has local irritation, no cardiac and no chest anxiety. When there is chest operation, think of Kalinitricum. When there is surface allergy to the eyes, think of ambrosia. Another remedy very close to the ambrosia is orundo. Orundo has intense itching inside the nose, while ambrosia has intense itching of the eyelids. Arundo has more itching in nose, palate, ears, desire to borrow the nose. Ambrosia has itching of eyelids, lacrimation is more prominent. Nasal itching, think of Arundo. Eyelid itching, think of ambrosia. Another remedy is aurum triphalum. Aurum triphalum has raw excoriating discharges, sore nose, lip, mouth. Ambrosia has irritation without excoriation, no rawness, no bleeding skin. Raw sore mucosa, think of aurum triphalum. Simple irritation of nose, think of ambrosia. Another remedy is ammonium muriaticum. Ammonium mur has thick white mucus discharge, chronic catarrh, nasal blockage at night, while ambrosia has acute seasonal reactive congestion, less discharge focus. So chronic catarrh, think of ammonium mur, and seasonal catarrh, think of ambrosia. Another remedy is ammonium phos. Ammonium phos has weakness, nervous exhaustion, vague catarrhal stage, morning sneezing, while ambrosia has patient is well with local irritation of eyes. Ammonium phos has general debility, while ambrosia has hypersensitivity. So, chest and asthmatic focus, think of pothos and chylinitricum. Chronic nasal blockage, think of lemna minor, ammonium mur, ammonium carp. Nasal itching inside the nose, ears and palate, think of orundo. Raw excoriating discharge, think of aurum triphalum. Pure seasonal eye and nose allergy with irritation, think of ambrosia. So, prescribing totality, seasonal hay fever, profuse lacrimation, intolerable itching of eyelid, nasal congestion or nasal bleed. This is all about ambrosia. Potencies, mother tincture or 6 potency or 30, frequently used is 6 and 30 potency. So, in 3 lines, we must think of seasonal, itching, irritation and congestion. This is all about ambrosia. Thank you for patience listening. We will see in next episode. Thank you very much.